Hi, welcome to another telehealth medicine information video. I'm Garvin, and this video is on POTS, or Postural Orthostatic Tachycardia syndrome. So the POTS, or postural, is related to the position of your body. Orthostatic is related to standing upright. Tachycardia is related to increased heart rate, and syndrome is a group of symptoms. So what is POTS? Postural tachycardia syndrome is an abnormality of the functioning of the autonomic or involuntary nervous system. To be diagnosed with POTS, an individual must experience a group of symptoms in the upright position, usually standing, that are relieved by lying down. A persistent increase in heart rate of 30 beats per minute, or 40 beats per minute if you're under 19, should be recorded within 10 minutes of standing. Blood pressure does not always drop in POTS. Fortunately, for many patients, symptoms will improve with a combination of lifestyle changes and medication. The autonomic nervous system. So, the postural tachycardia syndrome is an abnormality of the autonomic nervous system. The autonomic nervous system is in charge of all bodily functions that we don't have to think about, such as heart rate and blood pressure regulation, digestion, bladder control, sweating, and the stress response. The sympathetic nervous system is part of the autonomic nervous system. It produces the fight or flight or stress response when activated. A chemical called norepinephrine or adrenaline is released. Amongst other things, this causes an increase in heart rate and blood pressure. So what should happen to your blood when you stand up? So when a healthy person stands up, blood vessels contract and heart rate increases slightly to maintain blood supply to the heart and brain. So what happens when you have POTS and you stand up? So you know you have POTS when in POTS this automatic adjustment to upright posture is not working correctly, resulting in an excessive rise in heart rate, the increased norepinephrine in the blood, and altered blood flow to the brain. So the symptoms: orthostatic intolerance, which is a term that is used to describe symptoms of POTS. It means symptoms that occur on standing and are relieved by lying down. So in addition to heart rate and blood pressure, other bodily functions that are regulated by the autonomic nervous system can be affected. Symptoms can be debilitating, ranging from mild to severe and varying from day to day. Dizziness or lightheadedness, or pre-syncope, which is almost fainting. These symptoms usually occur when standing up, but can occur with prolonged sitting. Syncope, which is fainting or blackouts. Approximately 30% of people with POTS experience fainting. And palpitations. So palpitations are a sensation of your heart pounding in your chest. Also symptoms would be headaches. So approximately 2/3 of those with POTS have orthostatic headaches, which means they occur as a result of being upright and may be caused by reduced blood supply to the brain. Most people with POTS also have migraine-type headaches. And another symptom would be tiredness or weakness. So these are common symptoms of POTS and can last for a considerable time after a bout of symptoms of POTS. Another symptom would be brain fog. People with POTS often complain of brain fog, which is difficulty in thinking or concentrating. Another symptom would be shakiness or tremuliousness, and this is often worse when upright posture. Another symptom would be shortness of breath, so patients can feel breathless when standing up or with slight exertion. Another symptom would be chest pain. So chest pain is fairly common in patients and can be worse when upright, and the cause is not clear. And excessive or reduced sweating. And you can also have gut problems, and nausea is common, and other symptoms include diarrhea, constipation, abdominal pain, and vomiting. Many people with POTS are told that they have irritable bowel syndrome before they're diagnosed with POTS. They're often mistaken. And also a symptom would be poor sleep. Many patients with POTS have insomnia, and this can be trouble getting to sleep, waking in the middle of the night, and trouble getting back to sleep. Another symptom would be visual problems. So this can be described as excessive glare, blurred, or tunnel vision. Also bladder problems. So some triggers which may worsen symptoms include excessive heat. After eating, especially refined carbohydrates such as sugar, speed of positional change, so don't stand up quickly, and dehydration, the time of day, so maybe worse in the morning, especially after waking up, also your menstrual period, and deconditioning or prolonged bed rest, and alcohol, which dilates the blood vessels, and exercise, so occasional exercise, can cause one to feel worse, but an ongoing exercise program can improve symptoms. So, how is POTS diagnosed? Patients are usually diagnosed by a cardiologist or a neurologist. To be given a diagnosis of POTS, a person needs to have a sustained increase in heart rate of greater than 30 beats per minute within 10 minutes of standing. And those aged from 12 to 19 years require an increase of at least 40 beats per minute. These criteria may not apply to those with a low heart rate when resting. There is usually no drop in blood pressure on standing. Also, investigations, so it may be necessary for patients to have some of the tests such as electrocardiograph or an ECG. An ECG is performed to rule out any heart problems that may cause similar symptoms to those found in POTS. And the active stand test, and also the head up tilt table test. So this involves lying on a table that can be tilted to an angle of 60 to 70 degrees in a quiet, dimly lit, temperature controlled room. Also, it can be diagnosed with a 24-hour ambulatory blood pressure and heart rate monitor. Also, you can use an echocardiogram, which is a heart ultrasound, or a 24-hour urine collection sample. Individuals with POTS often have very low urinary sodium levels of less than 150 millimole per 24 hours. So there are types of POTS. There are a number of factors and disorders causing or associated with the condition, but in some cases, a cause is never identified. POTS has been reported to commence after an infection, such as a viral illness, and acute stressors such as pregnancy or surgery or a traumatic event or immunization. POTS in teenagers, so it usually starts between the ages of 12 to 14 years and may follow a very rapid growth spurt with worsening symptoms until the age of 16. So, and next is deconditioning. So being out of shape is present in some individuals with POTS. A traumatic event or illness can result in reduced activity or bed rest, and patients become unfit and the heart doesn't pump as efficiently as before. This can trigger symptoms of orthostatic intolerance, so patients avoid exercise, which makes their symptoms worse, leading to more physical activity. And there's a downward spiral of deconditioning which causes or worsens symptoms of POTS. Next is hyper-adrenergic POTS. Hyper-adrenergic type POTS is less common. This can appear similar to phenochromatosis, and tests may be needed to rule this out. So when upright, individuals may experience a sense of anxiety, tremor, and cold, sweaty hands and feet. Also, a good portion of individuals, there's a significant urge to pass urine after even a short period of time upright. True migraine headaches are also common. blood norepinephrine levels are often high, so blood pressure may also increase on standing up and not fall. And norepinephrine transporter deficiency and blockers. So this type of POTS is similar to a hyper-adrenergic POTS. There may be an abnormality in the gene that leads to too much norepinephrine circulating in the body. And there are many antidepressant and anti-anxiety drugs that work in part by blocking this transporter. These can increase heart rate and make symptoms worse in some patients. So other conditions associated with POTS include joint hypermobility syndrome. So joint hypermobility syndrome, which is also called benign joint hypermobility syndrome, or Ehlers-Danlos, type 3, is often associated with POTS. Hypermobile joints are common, especially in children, and this can be harmless and can even be an advantage in sport. If you can answer yes to 2 of the following questions, it is likely that you have hypermobile joints. Can you now, or could you ever, place your hands flat on the floor without bending your knees? Can you now, or could you ever, bend your thumb to touch your forearm? As a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits? As a child or teenager, did your shoulder or kneecap dislocate on more than one occasion? Do you consider yourself double-jointed? Joint hypermobility syndrome is one of the more common conditions associated with POTS. It is an inherited condition that can be passed down in families. The underlying problem is thought to be a faulty connective tissue protein that is found throughout the body, including blood vessels, joints, and gut, and may lead to stretchy or brittle tissues. Patients who have the combination of joint hypermobility and POTS tend to develop symptoms of POTS at an earlier age, faint more often, and suffer from migraine. So for POTS treatment, there's no cure for POTS, but treatment can help with your symptoms. So for medication, your doctor may prescribe drugs such as fludrocortisone, along with more salt and water, midodrine, phenylephrine, or a type of medicine called a beta blocker to help with blood flow. Compression stockings, so these help push blood up from your legs to your heart. You'll want ones that provide at least 30 to 40 minutes of compression and go all the way up to your waist, or at least up to your thighs. And these can be prescribed by a doctor. For your diet, salt and water are key to keep fluids in your body and raise the amount of blood in your body. Think pickles, olives, nuts, and salted broths. Eat small meals more often with a healthy balance of protein, vegetables, fruit, and dairy. Regarding exercise, POTS can make it hard to be active, but even light exercise such as walking or simple yoga can help with blood flow and keep your heart healthy. For lifestyle, if you get tired easily, you may not always have the energy to take care of yourself. Learn how to take your pulse and blood pressure. Ask your doctor what your number for pulse and blood pressure should be and check them regularly. For sleep, try to stick to a sleep schedule. You also might raise the head on your bed to make it easier to stand up after lying down. And communication, POTS can make simple activities a bit harder, and that can be frustrating and stressful. A support group or a therapist may help manage the emotional issues the condition can cause. So some general advice. Postural tachycardia syndrome can be debilitating, but fortunately there are many adjustments to lifestyle that can lead to an improvement in its symptoms. It's hard work, but can make a real difference. Treatment for POTS falls into 2 different categories: non-pharmacological, so without medicine, and pharmacological or using medicine. with non-pharmacological therapies being the cornerstone of any POTS treatment. In milder cases of POTS, those therapies might be sufficient to control symptoms and might be all that is needed. POTS has an impact on every aspect of life, which include the physical, social and psychological. Symptoms tend to fluctuate from day to day, making management a challenge. Medication can improve symptoms, but there are many non-pharmacological, so that's without medicine, methods which may help. So factors which may have an impact on symptoms include the time of day, so symptoms tend to be worse in the morning, rapidly moving from a lying, sitting to a standing position, and dehydration, food ingestion, extreme heat, using alcohol, physical exertion, menstrual period and prolonged bed rest or deconditioning. Your daily management of symptoms, so some ideas include: pace yourself throughout the day. Try not to fit too much. There will always be another day. Take your time and avoid rushing, and be realistic. Ensure that your goals are achievable. And planning, if there is something specific you need to do in a day, plan for it, rest well beforehand and create time to recover afterwards. And also limits, so learn to know and live within limits. Avoid stress. The autonomic nervous system is the body's fight-flight mechanism and is activated during periods of stress. POTS sufferers tend to be very sensitive to stressors, whether they are psychological, physical, positive or negative. And infections worsen symptoms, so rest and accept a reduction in activity levels. You may take longer than expected to recover. Stairs are a challenge. Try to limit the amount of times needed to run up and down stairs. Walk up slowly and steadily. Take a lift where possible. And mobility aids, for those with the most severe symptoms, the use of a wheelchair or mobility scooter may help to manage daily living. So elevating the head of the bed has been recommended. So that brings this video to an end. If you have any questions, you can leave them in the comments, or you can contact me by email through my website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.